talk to so many offices and so many teams and so many administrators and treatment coordinators who get really frustrated when a patient doesn't want to go ahead with treatment or comprehensive care, even though they know with certainty that that patient needs that work. You see, the focus I want to have is on the word needs. The patient needs that work, but unfortunately, they don't want that work. That's why these same offices, these same teams tell me that the patient says, nope, I just want to fix that one tooth there that's broken. I don't want the equilibration. I don't want the bite splint. I don't want all the other stuff done that doctor was talking about back there. As they set their Louis Vuitton handbag on the counter, as they pull out their Lexus car keys, as they sign a check for today's visit and the address is on a street that you couldn't afford to live on. It seems ridiculous, totally disingenuous that this same person who's paying for some very expensive niceties in their life that they value won't pay for the dentistry that they need. And it's because they don't want it. So our goal in our communication is to try and stay away from a conversation about what a patient needs, and instead work towards trying to get them to want it. We do this in a variety of ways, but one of the biggest is driving their curiosity and letting them kind of discover things with you when you do the exam, when you talk about the problem. My good friend Mary Osborne always says, stay in the question, stay in the problem, keep talking about the problem. How long? Well, until either the patient says, what do you think we should do about it? Or until your lips bleed. Just keep talking about the problem. Eventually, they will become curious. They will figure it out with you because you're using good visual imagery and intraoral cameras, and they'll come to start to ask questions back. Now you can maybe begin to talk to them about what they've sort of said that they want. You can sort of tell them what they need.